Faculty from public health, medicine, and engineering, plus graduate students and a fellow from public health have joined efforts around the topic Windows into Pregnancy, Shedding Light on Placental Health. Let's hear now from Professors Rita Locke-Caruso and Kelly Bakulski, and graduate students Kyle Campbell and Anthony Sue.
Thank you. This is Georgia, a baby born too soon, and so small that she could be cradled in one's hands. Tiny babies like Georgia face many trials. For example, as newborns, these babies may struggle to fend off infections, and their lungs may need to fight for every breath. In fact, being born too soon accounts for most deaths in the first years of life. For those who survive the early trials, the fight can continue into later years, as these children may need to cope with complications that challenge their growth, their development, hearing, vision, and more. The numbers demand that we pay attention to these babies. Each year, over 15 million babies are born at least 2 weeks too early, the medical definition for a preterm birth. In the United States, the number of babies born too soon is high, the 6th highest among the nations of the world. Right here in Michigan, 10% of babies are born too soon. That number jumps to 14% for African American moms. And preterm birth is expensive. It's estimated that preterm birth costs our nation over $26 billion each year. Most of the time, we don't know which pregnancy will end too soon. And too little of the time, we don't understand what triggers an early birth, and even less of the time, we don't know how to stop it. This is our core team. Our faculty cube includes a physician, toxicologist, and epidemiologist. Dr. Stephen Domino is a physician scientist. He cannot be here with us today on stage, but in his clinical practice as an obstetrician, he sees on a regular basis the problems we've talked about. It's his desire to see improved pregnancy outcome that fuels much of our enthusiasm for our team's work.
Another faculty member of our research team is Dr. Rita Locke-Caruso, whose research is driven by a passion for public health and to protect the unborn from toxicant damage. A final faculty member of our research team is Dr. Kelly Bakulski, who illuminates new approaches to studying risks and benefits in populations of pregnant women. The progress of our research team depends on the time, skills, and dedication of trainees working in the laboratory. In particular, we cherish the contributions from postdoctoral research fellow, Dr. Sean Harris, MPH graduate student, Kyle Campbell, and PhD candidate, Anthony Sue, myself. And all of this work is accomplished in a safe, supportive, and efficient laboratory environment maintained by research specialist Faith Bjork. Together, we formed our research team to help develop ways for clinicians and scientists to assess pregnancy risks. Medicine has long struggled with how to treat many of the disorders of pregnancy. Downton Abbey fans no doubt recall the episode in which a main character suffered from the pregnancy complication known as preeclampsia, a condition characterized by high blood pressure that develops during pregnancy. As was typical in the 1920s, the patient's condition was treated by confining her to bed for the remainder of her pregnancy. Sadly, modern medicine has not advanced much in the past 100 years in treating pregnancy complications, with bed rest still a common treatment. Pregnancy remains one of the great mysterious wonders of medicine. In particular, we understand very little about how exposures from our environment affect pregnancy. We understand in general that environmental stressors influence risk for developing pregnancy complications, but we should know more about which ones, when, and who is at risk. What is needed are new tools and approaches to allow us to open a window to monitor critical events happening during pregnancy. Our research team is focusing on the placenta, the organ of pregnancy that shuttles nutrients and messages between the mother and the baby.
One potential window lies in the blood of the mother. The placenta is continuously bathed in maternal blood during the pregnancy, providing necessary oxygen and nutrients to the developing fetus. We've learned that the blood contains structures 1,000 times smaller than cells. They look like tiny lipid or fatty bubbles, and the tiniest ones are called exosomes. They're produced throughout the entire body. Our research team is investigating those bubbles released by the placenta into the maternal blood during pregnancy because they may reflect what's happening inside the placenta, and they're readily accessible from a maternal blood sample. The blood contains bubbles from all kinds of organs, not just the placenta. Some come from the brain, others from the heart, and still others from the liver. But it's the bubbles from the placenta that may shed light on what's happening in the pregnancy. A critical challenge our team faces is isolating just those bubbles that came from the placenta, and we're developing methods to do just that. Exosomes, or these lipid bubbles, were first described in the 1970s in the study of liver cell maintenance. They were so small that at first scientists figured they must be empty, but that wasn't the case. Next, folks thought they were simply garbage bags full of unwanted cellular trash or debris. Now, however, we understand that these bubbles contain valuable contents: DNA, RNA, lipids, and hormones. Furthermore, in 2007, scientists observed cells communicating using these bubbles. This represents a new paradigm in how cells and tissues can communicate with one another across the body. By studying and deciphering the content of these bubbles in the context of pregnancy, we hope to give scientists and clinicians a new tool to understand the health of the placenta and what that may mean for the state of the pregnancy. And all this can be accomplished with just a blood draw.
Here are tiny bubbles that we isolated from maternal blood collected from placenta tissue. We use a specialized instrument that mimics the structure of a blood vessel and allows us to watch these bubbles in action. So here, our placenta bubbles are flowing in real time. We can see that they're indeed spheres and that they come in a variety of tiny sizes. We use this instrument to count how many bubbles we have in a sample and to measure their distribution of sizes. Critically, by investigating what's inside of these bubbles that come from the placenta, we may obtain new clues about who is at risk for preterm birth and how to treat it. Our promising preliminary research, supported by the MCubed program, has allowed us to expand the scope of the current study and to compete for additional funding opportunities. Ultimately, the goal of our work is to improve every pregnant woman's opportunity to have a healthy pregnancy that goes to full term with the delivery of a healthy baby. And by investigating bubbles found in maternal blood that come from the placenta, we're able to have an unprecedented window into the status of the fetus. This is a safe and unobtrusive method to obtain messages directly from pregnancy. And by investigating these structures, we hope to be able to better inform biomedical research and clinical diagnostic and treatment options for conditions such as preterm birth. It is our new research into this area of placental exosomes, which we hope will push us forward on our goal towards healthy babies. Thank you.